Hi there, welcome to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. This week, I wanted to address medical consent. Now, that can be consent to care, which includes a procedure or a specific type of treatment. Consent means given permission for something to happen or agreeing to something. When consenting to care, it typically includes the care provided by that practice, group, or hospital, and an authorization for emergency care is usually included. In order to give what we call informed consent, that would require you to be informed or told, educated about what's going to happen, the risks and benefits associated with that treatment or procedure, and what the alternative options are, including no treatment at all. As outlined in an article published by American Family Physician, in order to give consent, you must have four things. One is an understanding of the situation, which means you understand what's happening and what's being addressed. Two is an appreciation of the consequences of the decision, which means what happens with each option. Three is having the reasoning in your thought process, which means that you're able to think it through and use logic. Four is an ability to communicate your wishes, which means you're able to tell your healthcare team what you want to happen. Any of these can be difficult if you don't understand, so don't be afraid to ask questions. It is usually readily apparent if you have the capacity to give consent, but a formal evaluation on capacity is completed if there is any reason to question capacity, which can happen in the hospital setting. In primary care offices, when you consent to medical treatment, it's usually including all that you want to see the doctor for. However, consent for specific procedures in that same practice may require that you sign a separate consent form. An example of given consent using hypertension or high blood pressure is starting off, you need to understand that your blood pressure is higher than the acceptable normal ranges, which could be from several factors such as your diet, stress, smoking, or many other factors. The options include making changes to your diet, like decreasing the salt in your diet, increasing aerobic exercise, or medications may be necessary to bring it back into normal range. The benefit of that is improved health, which means you can stick around for longer to be with your family. The risks of untreated high blood pressure may include a headache, chest pain, shortness of breath, or more severe symptoms such as a heart attack or stroke, which can be fatal. So, once all information has been presented and there's an understanding, then patients can decide what they will or won't do to improve their blood pressure. That is making an informed decision regarding treatment. Another form of consent that is typical in a medical setting is when you are consenting to a procedure. Similarly, the procedure should be explained along with the risks, benefits, and alternatives in order to help you make an informed decision. So, when you are presented with papers to sign, please don't be afraid to ask questions or simply state that you do not understand. Don't be embarrassed because, as mentioned in a previous discussion, even those with normal or high literacy may have poor health literacy. That means most people may not fully understand. I encourage you to speak up, be empowered, and participate in your healthcare. The takeaway for today is consent requires you to be informed. So take the time to understand what you're consenting to, including the risks, benefits, and alternatives. Also, a general practice may have a general consent to care, but there are procedure or treatment specific consent that may be required as well. Don't be afraid to ask questions. I cannot stress this one enough. Don't be afraid to ask questions. You can view additional information on consent to medical care by connecting directly to the American Family Physician website below. This video is not a substitute for seeing your doctor for an appropriate evaluation. Come back again next week and we will have a live Q&A about the previous topics, preparing for a doctor's appointment, medical release forms, and today's topic, medical consent. Let me know in the comments your preferred time for our Q&A on Monday, January 30th. You can connect with us on social media platforms such as Twitter and Instagram at Amaize Health or the website www.amaizehealth.com. I will continue discussing health-related topics on this YouTube channel, and as you listen, be sure to like, share, and subscribe. Again, this is Dr. Thorpe Amaize with Amaize Health. See you next week.